Hey everybody, thanks for joining me today with another great word of the week at Turnpaugh the Wellness Center. Today's word of the week is going to be SOT, which stands for Supportive Oligonucleotide Therapy. We're going to dive into what is SOT, how does it work, or can it be administered, and what can you use it for? Let's dive in. So, Supportive Oligonucleotide Therapy, SOT, is a new therapy that's starting to catch a lot of buzz and a lot of attention because of the success that patients are having with SOT. And so what SOT is, or also known as antisense therapy, is it takes genes and it silences the gene and prevents replication of certain microorganisms. And we'll talk about what microorganisms we're talking about specifically here. So it's a really cool therapy that basically turns off the replication of certain viruses, bacteria, and other microorganisms. So let's just dive in a little bit quickly here to what this therapy does. But before we do that, we need to know a little bit about how genes work, or the genetic aspect of turning DNA into RNA into a protein. So we make DNA, our nucleus in the nuclear envelope makes DNA. Okay, then we have transcription occur, and that turns in RNA. Okay, now typically how we take that RNA and we turn that into a protein, we use something called mRNA, messenger RNA. So it sends the code to make essentially the protein. And proteins are made throughout our body, and they're really important for the expression of that organism. So what happens here, this is the big point here. So the SOT makes a nucleotide. So this SOT is a nucleotide, hence oligonucleotide. And basically all this nucleotide does is it takes that messenger RNA and it cuts it in half, because it's typically a double-stranded mRNA, meaning there's two pieces of it. So it cuts it in half and it leaves a single strand. Then the nucleotide that we are administering, the therapy that we're administering, attaches itself and silences that mRNA, so now it cannot be expressed in the protein. So all we're doing again, we're taking typically that double-stranded mRNA, we're removing one of its strands, and then we are putting the SOT nucleotide in to silence that so the microorganism can't replicate. It basically kills the microorganism because it has no way to replicate. Think of it as we're almost shutting off its food supply, right? So the big thing here that you can see is it prevents replication into the protein. This treatment's really cool. It can be used one time and can last up to 6 months. So it can be working 24/7, 7 days a week for up to 6 months. Now, typically, we're going to reevaluate at our clinic here in about 4 months. But it's interesting to note that can be as effective up to 6 months. Now, how does this work from a administering aspect? So we draw your blood. We send that to Greece along with a lab that reports a positive finding of the microorganism that we want to find. For example, for Lyme disease. So we send that along with Greece. The lab then makes a specific SOT to that microorganism. So if it is Lyme, it makes a specific therapy, SOT therapy to the Lyme disease. And it makes sure, in the case of Borrelia burgdorferi, that it targets multiple strains of that Lyme disease, okay? And then when we get the SOT back, we then administer that SOT via an IV. And that's how it typically is administered, okay? Now, who can benefit from this? So the first thing I would say is this treatment would be for most patients who are dealing with these chronic issues. They have been struggling with this microorganism, whether it be a virus or bacteria, for a very long time and still not getting to the point where they have it resolved. Now, obviously, people who just have the infection, if they choose, they can. I would lean, again, more towards chronic patients that have been dealing with this organism. So who can benefit? People with Borrelia burgdorferi, Lyme disease, co-infections, whether it be babesiosis, Bartonellosis, anaplasmosis, EBV, Epstein-Barr virus or mono, HHV, human herpes virus 1 and 2, HIV, human immunodeficiency virus, HPV, human papillomavirus, Coxsackie virus, hepatitis C, B, varicella zoster, shingles, chickenpox, and even chronic fatigue syndrome. So again, people who have been struggling with this for a long time, this would be a really good therapy to look at. Now, I know with this, a lot of people might be talking about like COVID. That's something I really can't comment on because it's so new. It might be a therapy in the future, but right now I don't have any information in regards to that. So this would be an awesome therapy. I'm really excited about it. At Turnpaugh Health and Wellness, we are integrating it into our practice. So if this interests you, or you've been a patient who's been dealing a long time with these various organisms, please don't hesitate to reach out to the office. We'd be more than happy to talk to you, more details about this treatment, and just share the word with anyone if you know anyone that's been struggling with it. These viruses or bacteria for a long time. Share this information. We're just here trying to help everyone. Thank you for your time. Have a great day.